Ever wonder what you do in a psych hospital? Hey, what's up guys, it's me, the Psych David C. I get asked all the time about what actually goes on inside a psych hospital. A lot of people are scared to go to a psych hospital because they don't know what's going to happen once they get inside. So in this video, I'm going to break down what actually happens from a patient perspective when you're admitted into a psych hospital. Let's talk about it. Now keep in mind, this is all based on my own experiences at my own psych hospital. So let's just start briefly about how you get admitted into a psych hospital in the first place. So in California, at least, you have to meet at least one of three criteria, with the first being danger to self, the second being danger to others, and the third being gravely disabled. So you can literally just walk into your local psych hospital, then they'll have somebody evaluate you to see if you meet criteria to be in the psych hospital. They're probably going to ask you some questions like, do you have thoughts of hurting yourself? Do you have thoughts of hurting others? Stuff like that. So if you meet criteria, they'll walk you inside, and keep in mind that psych hospitals are locked. So once you step inside, you can't really step out until your assigned psychiatrist lets you leave. Okay, so once they walk you onto the unit, the first thing they're going to do is a skin check, which means they're going to pretty much have you strip all the way down and then look over your body for cuts, bruises, or scars or anything like that. This doesn't happen at every psych hospital, but at mine, they do make patients do that. And then the staff members are going to check all your stuff, like whatever you brought in, your phone, clothing, basically anything you have on you. They're basically going to inventory and write down everything that you brought in, so you get everything back once you leave. Because there's certain things they don't allow in the units, like anything that's sharp or anything that has strings in it. So they're going to lock up all the things that you're not allowed to use while you're in the hospital. And then you're going to have a nurse basically do your admission assessment. They're going to ask you similar questions that the evaluator asked you, and they're going to explain to you what's going on. They're going to explain to you how everything works, and they're going to show you around the unit so you know where everything is. At my hospital, every patient is assigned a psychiatrist and a medical doctor. So your psychiatrist is the one who prescribes all the psych medications and who decides when you get to leave. And the medical doctor pretty much takes care of any other medical conditions you may have, like diabetes or hypertension. And they both have up to 24 hours to see you. So let's just say you get admitted at 2 p.m. They have until 2 p.m. of the following day to see you in person. One thing you should know is that staff members are going to be checking up on you literally every 15 minutes of the day, just to make sure that you're safe. So you're basically going to have no privacy, but it's done for safety purposes. So basically every day starts in the morning when the day shift comes in. So basically 7 o'clock in the morning. After the nurses and all the other workers get report from the night shift, they're going to have people come and take your vital signs. So you're probably still going to be in bed, half asleep, and somebody's going to wake you up and put a blood pressure cuff on you. It's most likely going to be a CNA or certified nursing assistant or a MHW or mental health worker that's probably going to be taking your vital signs. They're the ones who are going to be basically on the floor at all times. So if you have any questions, you basically ask them, and then they'll tell the nurses. And then sometimes they'll ask you what your goal is for the day. It can be something simple like talking to your doctor or taking your medications or something easy like that. It's just something they have to ask and write down for every patient. You can also say you have no goal, but that kind of looks bad on you. And then after they finish taking everybody's vital signs, they're going to serve breakfast. And then this is also around the time where your nurse is going to be coming around with your morning medications if you have any scheduled. So let's just pretend I'm your nurse and you're in your bed eating breakfast, and I'll just be hello, so-and-so, my name is David, I'm your nurse for today, blah, blah, blah. I have this medication called Lexapro for you. Have you heard of it? Have you taken it before? And then a lot of nurses will also do their assessment on you during the same time that they're giving you medications. So they might ask you something like, do you have any thoughts of hurting yourself? Has it gotten any better? Do you hear any voices? What do they say? Stuff like that. Because they're pretty much trying to track your progress during your stay. Let's just say, for example, you say your symptoms are getting worse, then they'll know that the medications they're giving you aren't working. And then for your psychiatrist, the one who prescribes all the medications and decides when you leave, they generally only see you once per day, and it's going to be pretty short, maybe a couple minutes. They come on their own schedule, so most of them show up during the morning time, but there's some psychiatrists who show up at 10 p.m. at night. So it's kind of luck of the draw, which psychiatrist you get and how they are. So your first meeting with your psychiatrist, they're probably just gonna ask you why are you here? How can we help you? What medications have you taken before? And then they'll explain to you like what medications they want to prescribe for you while you're there, and like how long they plan on keeping you there until they discharge you. Just on average, a patient stays at my psych hospital for about 5 to 7 days. And then after that, there's usually a lot of like group activities going on. There could be different types of groups. Like sometimes there's a music group where they literally just bring a boombox and play music for everybody. Sometimes there'd be like coloring pages and everybody just gets a marker and starts coloring their pages. Some of them teach like coping skills on how to deal with stress. And sometimes there's even AA meetings. So yeah, after those morning groups, then it's gonna be lunchtime. If you have any medications that are scheduled to be taken at lunchtime, then your nurse will come give it to you. And then after lunch, sometimes there's more groups or sometimes there's just free time. For free time, there's generally just like a day room where like all the patients can just hang out and mingle and like watch TV and stuff. Now keep in mind, all of this stuff is optional, but I mean, if you stay in your room the whole time and you don't participate in groups, then it's kind of gonna look bad on you to your psychiatrist. So they're gonna encourage you to participate in as many things as you can. And then my hospital has designated visiting hours. So if you have people that want to come visit you while you're in the hospital, they have to make an appointment. They can't just come whenever they want. The visiting hours at my hospital are like 3 p.m. to 4:30 p.m. And then on other days, it's 7 p.m. to 8:30 p.m. But each visit is limited to 30 minutes. And then after that, there's dinner. And if you have like evening meds scheduled, then your nurse will also bring those to you around that time. And then after dinner, there's pretty much nothing going on until like 10 o'clock when they shut everything down and expect everyone to like go to their rooms and sleep. And if you have nighttime meds scheduled, the nurse will bring those to you as well. Sometimes if you're having trouble sleeping, you can ask your nurse for a sleeping medication. Honestly, I can see it being pretty hard to sleep at a psych hospital because you have staff members checking on you every 15 minutes. So basically every 15 minutes, someone's gonna be like opening your door and like looking in and then closing the door, and those doors can be pretty loud. Honestly, I would hate having to try to sleep at a psych hospital, honestly. And that's basically the gist of what a typical day is like in a psych hospital for a patient. Like the next day, you just repeat the same things over again. So honestly, being in a psych hospital is pretty boring. So unless you really need to be there for your own safety, I wouldn't recommend going there. If you're just kind of like, depressed and you have some thoughts here and there, you most likely wouldn't need to be locked up in a psych hospital. I've had a few patients who are like that. Like they'll come into the psych hospital expecting something else, and then they realize within like the first 30 minutes that that's not the environment that they need to be in. So honestly, I would really research the psych hospital that you're thinking about going to before you like admit yourself into the hospital. Because once you get in, you can't really just leave whenever you want. But anyway, that's what a typical day for a patient looks like at my hospital, at least. I hope you found this video helpful. If you did, make sure to like and subscribe. I do a lot of videos on like psych related stuff. I am also on TikTok and Instagram if you want to follow me over there at the Psych and PDOC. I do medication management for adults living in California. If you're interested, there's a link down below. And with that, your mental health just leveled up 1.